advise for a knee replacement, what we do is, in this, the different ways of going about doing your knee replacement. So there are three variables. One is how you are approaching your knee, whether you are cutting too much of muscle or not. Second is what type of implant you are using. Third is the rehabilitation program. So these are the three variables which are various doctors have different opinions about it. What we do is that basically it is scientifically we do it. What I do is that this is the thigh muscle which is present in front, is called a quadriceps muscle. This muscle has got a very good function of making you up and down the stairs or getting out of the chair. This muscle functions which is present in front of the thigh bone. Lot of 90% of people cut this bone muscle to go into the knee joint. Whereas we do not cut, we put a small cut in front of the knee, only cut this part of the capsule which covers the bone, and then we invert this patella, we do not cut any muscle. So what is the advantage? This is called a subvastus approach, or MIS, or in full form it is called minimal invasive surgery. What is the advantage? We are not cutting your thigh muscle. So the patient can get out of the chair on day 2 and start walking and start climbing stairs and do squatting and cross leg sitting. Now that also depends on the type of implant you use. So first thing is approach. What we approach is MIS, subvastus, quadriceps, sparing, incisor. So we do not cut, it is a small cut and the patient feels very comfortable, can do all his activities. So this is about the approach. Second thing what we do is an implant which we use. The implant has got, one is the design, other is the material that is used. Front of the thigh bone, it should be very thin so that the patella can easily move around. It's called patella friendly implant. Second is, it has got a center radius, and this implant has got more radius, 7 radii, so that your flexion and that is called bending and straightening is easier, and it is more anatomical, that means normal. Third thing is that the most important part is the joint is Hiflex. That means this implant has got allowing you to bend your knee beyond the flexion that you get out of the chair or sitting in the chair. That means you can do squatting and cross leg sitting. Normal implant also, if you do exercise, you can do it, but it gets spoiled over a year. Whereas this implant is designed to withstand excessive flexion like squatting, that means bending, excessive bending like in squatting or cross leg sitting, and still will be lasting for more than 30 years. So this type of implant what we use is, second is the implant. Third is that we make the patient rehabilitation program. We do not say to the patient that you need to do more exercises, only 2 to 3 weeks of good exercises. Patient is allowed to sit cross leg, patient is allowed to climb stairs, patient is allowed to do squatting, and patient is allowed to walk as much as possible in 1 to 2 kilometers within 3 to 4 weeks. As much as possible, as much as his age allows. So that is the rehabilitation program. So these are the things we do in a knee replacement. One is that what type of surgery we do, what type of implant we use, and we use more of early rehabilitation.